Hello, everyone, and welcome to today's session about the new healthcare issue materials. I'm Darla Minnick with National Issues Forums Institute, and we are delighted that so many of you have joined us today. Before we begin, I'd like to go over a few housekeeping items. We request that you remain muted throughout the session to avoid any background noise. If you have joined by video, please check the microphone icon, make sure there's a red line through it. If not, simply click it. You'll see the red line and that will indicate that you are muted. If you've joined by phone, please mute your phone. We do want to hear from you throughout the session, so if you have any questions for us or anything that you would like to share with the group, feel free to send that through the chat box. We'll spend the last 30 minutes or so of the session interacting with you all. And the session is being recorded, and the recording will be available on the NIFI website in a day or so. So without further ado, I'd like to turn the session over to my colleague, Jean Johnson. Jean's a Kettering Foundation Senior Associate, a VP of NIFI, and one of the project managers for the Hidden Common Ground Initiative. Jean.
Thank you. Welcome to everybody. You know, it's such a busy time the first week back from the holidays. So we're really grateful that you're going to spend some time with us. This session is devoted to our new issue guide on healthcare costs. I think, as a lot of you already know, it is part of our work on the Hidden Common Ground project. So I'm not going to go into all the details about Hidden Common Ground. You can go to the NIFI website, and there's a lot of material there. But the bare bones is that we're going to be doing a healthcare issue guide and supporting you to conduct forums in February and March this coming year. In spring and early summer, we'll be issuing a new immigration guide and working with you to conduct forums. And then in August and September and into the fall, we'll issue a new guide on the economy and working with you to conduct forums. And while all of that is happening with NIF, USA Today will be doing coverage and commentary on the issue at hand. Public Agenda will be releasing public opinion research on the issue at hand. We've just had some late-breaking news that some NPR stations are coming on board. So it's a chance to hold forums when there's a little more media and leadership attention to the issue. And we hope it gives people who attend forums, you know, a way to follow up in the media and learn more about the issue they've just discussed. So we'll be doing the overview of the healthcare issue guide. My colleague Brad Rourke will do that. He's a Kettering program officer and the executive editor of all the issue guides. There's lots of balls in the air. I'm going to be joined, we're going to be covering some questions to motivate and support deliberation on healthcare. I'm going to join, at least in heart and spirit, by my colleague, Kara Dillard. You can see her friendly face. And we have her brain with us, and she's going to be writing us notes, but her voice is absolutely terrible and raspy and the sort of form of laryngitis, so we're encouraging her not to talk, but she is here with her mind to help us out. As Darla mentioned, there will be time to get your ideas after we do the formal part of the presentation. We are going to be, after the session is over, we will be sending you a copy of the PowerPoint, so you don't need to take notes. We're going to be sending you a short 3-page document that is called The Essential Elements for Moderating Deliberative Healthcare Forums. In the office here, we affectionately call it the moderator's cheat sheet, but it's just a briefer document that can help you when getting ready to moderate a forum. And as we'll be telling you later, we are going to be making free forum kits of materials available to those of you who are convening forums in your communities or institutions as part of our Hidden Common Ground project. And so we'll be having some logistical information on that later. But now I'm going to turn it over to Brad.
Hey, Jean, thank you so much. It's great to see all of you here. Many of you I know, many of you I don't. I'm actually more excited to see all the people I don't know, because that's awesome. Not to diss anyone I do. Our intent with this meeting here is to give people time to ask questions at the end. So I'm going to minimize what I say to what's really necessary. So just to give a quick sense of where these issue guides come from, I think the thing to know about them is they come out of a process that focuses on doing rigorous and in-depth research that's not only research in terms of what you could learn at a library and online, but also talking to actual people in actual places about their concerns, about any issue that NIF does an issue guide for, and that that the resulting guides are tested again with people in actual places. They don't just come out of a room somewhere. And finally, that these issue guides are designed for people to use in conversations together. So they're not intended to be didactic or intended to teach you about the issue. They do that, but that's not their main purpose. Their main purpose is to be useful. For each issue, we have a whole range of things available. One is an issue guide. Another is an issue advisory, which is a brief version of the guide. It's what people can use in a forum together, designed to be read quickly on your lap. For this issue, we'll have a Spanish version of the advisory available for forums in Spanish. There's a questionnaire that people fill out at the end, and there's a starter video that will be made available as well. I just saw a cut of it, and it looks great. Again, we're hoping that these forums on this topic, on healthcare, take place roughly in a February 10 through March 13 timeframe. But of course, you're welcome to hold them whenever you want, but we hope they'll happen in that timeframe to better mesh with the Hidden Common Ground issue. Darla, if you would advance to the next slide, that'd be awesome. Thanks. As many of you know, each forum essentially has 4 parts. You start with ground rules and introduction to the issue itself. People talk about their personal connection to the issue. That's part 2. We give equal time to weighing each of the 3 major options. So that we each can get a fair hearing, focusing on not only what we like about each option, but also what maybe we don't like. And then, very important, we end each forum with a time for reflection. The issue guides are designed to support that kind of conversation, and so you can see that recapitulated. And all of this is going to be sent to you in a link afterwards, after this meeting, with the essential tools for being a moderator. But if you could advance again, I'm going to spend the most of my time just quickly giving an overview of the issue, and more importantly, talking about the thrust of each of the 3 major options. I think what's important to know about the healthcare costs issue is not just that we all know as individuals, healthcare is of great concern. There's high bills, high costs, so we're all worried about it, but also on a national and community level, we're quite worried. Many of us are quite worried too. It's one of the top issues. Healthcare costs are a major problem for the nation as well as us in communities. We pay a great deal for healthcare, and we seem to have less to show for it than other countries do. We pay roughly double what other developed nations do. Not only that, but the healthcare system is very complicated. It's a nightmare for many individual people to negotiate it and figure out what to do. Prices are unpredictable and confusing. So the presenting point of this issue is that the ways to move forward, given this system, are complicated, and anyone is going to have important drawbacks. So the way forward is not obvious. There's not an obvious right answer. We just have to figure out what's right for us for now. Darla, if you could move to the next slide. Every issue guide essentially has 3 or sometimes 4 major options They're not the only possible options to address the issue. In your forum, you might come up with your own, which is great. And but these are the main ones that that are out there in the common discourse, and they're really major directions, and each one comes from a very different sense of what's the thing that I value most, and what's the thing I'm concerned most about. Each of these has a major drawback, and they're sort of in tension with one another. We can't do them all, and some of them are even diametrically opposed. The first option says that, you know, that the issue here is that it's not fair that some people have health care and some people don't. We need to make sure that everyone has health care, and that the best and most straightforward way to do that is to create a single public health insurance program, not unlike Medicare, so that everybody is covered, a governmental insurance program. This is a bold change, and raises some important questions that Jean will address when we talk about ways to elicit deliberation on each of these options. The second option says, well, you know what, while fairness is important, it's really important that we move prudently, and that we move safely. That upending the system, creating a huge changes is something that may create unintended consequences that we want to be careful about. So this option says, in a broad sense, let's build on what we have. Let's take what works, make it better, and don't throw the good out with what's not working. And one of the key drawbacks here is that you know, the system still remains complicated, and it doesn't necessarily directly address the costs of the system. So there's a number of questions to ask about that too, and again, Jean will go into that. And third and finally, there's an option that says, you know, the most important thing is that we have the freedom to make our own choices, the freedom and really responsibility. These are core to American values, and it's critical. What this option says is that, you know, if people had to make their own choices and had what you might call skin in the game, a little more skin in the game, that's the best method to ensure that everyone has the freedom to do what they wish, but B, to also make their own personal decisions that could, in the aggregate and overall, begin to reduce the overall healthcare costs for society. And it says that, you know, we should allow insurance companies to provide sort of catastrophe-only plans. We should allow people to have no health insurance if they wish, or to buy the minimum. And here again, and we should force providers to make sure that we really know what the costs are that we're facing and what the prices are of things. Here again, there's an important drawback that people might not, given all this freedom, make the best choices for themselves. They certainly might not make the choices that we would make for them. And some people with limited plans will still get sick. And so we'll have to figure out what to do with them. So those are three overall options, each of which has a major drawback or trade-off that we really have to focus on. And there's a set of questions that Jean will talk through that really will urge people to focus on the deliberation, which is not what do I like, but what do I feel about what the trade-off is, and what can I live with, and where are we still divided and have work to do. So that's this in a nutshell. On purpose, I didn't go into depth. You can read the issue guide and take a look at it, or if you have direct questions afterwards, we'll be of course happy to answer. Jean, would you take it away and talk about ways to elicit deliberation from these and on these options?
I will indeed. So we're going to go to our next slide. This is a very, very complicated issue. And based on, I saw some of the pre-testing for the forums, I've seen healthcare forums that we've done in the past. The problem is not to get people talking. Everybody has a story, people have a lot to say. The problem is to get them to try to think more deeply and to look at the complexity and to begin to wrestle with the complexity. And you know, my experience is that once people begin to wrestle with the complexity, you know, it's tough, but in some ways it's empowering, because it does enable them to understand the debate better. It enables them to think about what they want their country to do, their states to do, what they want to do. It's really empowering to understand some of the complexity and some of the downsides and the trade-offs and the unintended consequences. So I'm just going to flag a few things that we have seen happen in forums where you as a moderator can really, it's not so much that none of us are healthcare experts and we don't all have all the facts and figures at hand, but we can raise considerations for people to think about. And you know, our experience is that people really do feel respected and involved when we do that. So, you know, Brad mentioned one, people will talk a lot about what they're paying for healthcare, what it costs. You know, we are paying enormously as taxpayers because government at all levels has healthcare costs. Businesses have healthcare costs. So to just keep bringing into the forums and what you pay as an individual, what we pay as a society, and if the costs go up, and with an aging society and we don't rein them in, we're going to be hurting as individuals and our society is going to be hurting. There's going to be things we can't do because we're paying so much for healthcare as individuals and in the other forms. You know, I think it would be great, and probably everybody would love it, if we could set a healthcare system that everybody got the care they needed when they wanted. It was high quality care and it was very affordable and reasonable for individuals and for government and for whoever else is paying. So that would be the ideal, but it is very, very tricky and difficult to do this or even to get them in balance. So one of the things in the forum is to keep those three elements in people's minds. You know, if we do this, would it affect the quality of coverage? If we do this, would it reduce people's access? Would fewer people have access to healthcare? So to keep people thinking about all of those, and as Brad mentioned, this, you know, the desire for change, very, very few people want to keep our healthcare system exactly as it is now. But there are risks to change and there are unintended consequences. And we take the forum as an opportunity to think about those ahead of time. You know, when people leave the forum, our goal is for them, whatever preference, they can have whatever preference, whatever proposal they like, that's fine with us. You know, we're not trying to sell anybody on any particular proposal point of view. But we do want people to own their views, and that is, so it's not enough to endorse preferred. You have to be have thought a little bit about how in real life it's practical. What are the downsides? To really own it in the sense that you're a little you kind of question yourself about, is this idea that I'm attracted to, is it really going to work? Is it really going to work the way I do? So a couple of things we've seen happen in a lot of forums. Again, I thought I would just flag them for you because we see it a lot. You know, typically in forums, the idea of using prevention to lower costs and to have more transparent, to have doctors and hospitals be much more upfront and clear about the costs ahead of time. Those are very popular ideas. You know, I'll be surprised if there are very many people arguing against them in the forums. The question that people have to say once they say, well, I'm all for prevention or I'm all for transparency, is number one, it's hard to do. You can be for it, but it's very hard to do. And secondly, is it enough? You know, if we have more prevention and we're more transparent, but we keep the system we have, is it enough? There's no right or wrong answer on that. People should think a little bit about it. You know, I would be very surprised in the forums if we didn't have a lot of people who are very concerned about people who don't have access, don't have insurance. They're concerned about the holes in their own insurance coverage. The idea that we should really expand coverage and improve quality. And, you know, the recognition is going to cost something, so we'll cut a cost, we'll raise taxes. It's a very common point of view. It's perfectly fine to leave the forum with that point of view, but you do need to test it a little bit. So, you know, what programs are we really looking at? Are we really going to cut the military in the state of the world these days? You know, what are the other options? If we're going to raise taxes, We want to improve schools. We want to not add to our debt. We want to have a better infrastructure. We want to expand science. There are many, many things we want to be realistic about, not just kind of a general, vague statement of how we're willing to pay for this, but to really press ourselves a little bit on how realistic it is. And I think the much tougher question, I think the way that I like, what's politically doable given our, I support myself. What could we do? What can we expect in the nation? What can we expect in our communities? What are we willing to live with, as Brad said? Typically in forums, there's a lot of energy around cutting waste and duplication. People will have examples of waste and duplication. Most of us probably have them. The question, to make it a little tougher, is so who decides who's wasteful and who's not? Do we trust the government to do it, the doctors, the hospitals? I think a lot of us have been in a situation where there's another test you can do. Maybe it's not needed, but it would really help be certain. Somebody we love. There's a tendency to want to just do everything possible to be certain and clear. So who decides? Is that wasteful, or is that necessary? The line. To get people to talk about that. Again, no right answer, but to get people to wrestle with it a little bit. There could be people in the forums who are very, very concerned about government being involved in healthcare, not just a kind of Medicare for all kind of plan, which would be a larger responsibility for government at every level. I mean, very suspicious government. So that's fine. That's a perfectly valid concern. But when you do want to have people, so we're worried about a public insurance plan, private insurance. Is that good? No, it's good. Yeah, let's talk about our experience with both kinds. We're worried about government and whether government can do anything well. And yet Medicare is a government program. The costs are typically lower, and it's very, very popular. This is not that we want to convince people that government is good, but that you want people to kind of wrestle with that kind of top of the head reaction they may have that's very against government getting involved. And I think the other top of the head reaction that we would get is you just shouldn't make people buy insurance. It's not right. And I think, probably most of us can identify with that. You don't want to be forced to do anything. But I think, as Brad pointed out, it's a very appealing idea. But the truth is that if we don't have young and healthy people buying insurance, the cost will go up for people who have serious illnesses and for older people who have more healthcare needs. And, for young and healthy people, accidents happen. Sometimes young and healthy people get serious illnesses, and what do we do then? So again, no right or wrong answers. You're not trying to sell anybody on any point of view, but just get them to test themselves and to talk among themselves about the experiences they bring to the table that will help them think through whether these are good ideas or whether they want to have some second thoughts about them. So going on to our next slide, we actually have in the book, you do not need to write these down on our next slide, which we are going to. Our next slide. Darla, can you advance the slide? We have in the book for each of the options that Brad outlined, we've actually provided you with some questions that may, the previous slide, please, that may, help you push the conversational. You can reword these to fit your forum. You can read these ahead of time, just have them in mind. There's not necessary to go through all of them step by step, but they are there. Use them, think about them, adapt them, and see if they can help you enrich the conversation. And then the next slide, when you're wrapping up, it's often a good idea to kind of step back. You're going to have a lot of ideas on the table. People have kind of talked about them. And, there's sort of global choices that we have, and their priorities. So on this little chart here, some version of this is actually in the questionnaire. But you want to preview it a little bit with your forum. So, is it more important to guarantee that everyone is insured, perhaps through a Medicare for all? Or is it more important to have a system where you always have some government and private insurance plans? And so we don't have a kind of a unitary system. How do we feel about that? Is it more important to push doctors and hospitals and others to rein in costs? Or do we want to, is a priority to concentrate on quality and medical progress? Hopefully you can balance them, but how do we feel about the priority? Is it more important to prevent healthcare costs from adding trillions to the federal debt? Or is it more important to act boldly and let's go for something like Medicare for All now, one of the few countries that doesn't have something like, this is a question where experts and politicians are just, at a battle. I don't think anybody can actually answer this question. You don't have to answer it in your forum. Nobody will ever be able to predict for certain exactly how this, what's going to cost and what it will add to the debt. That's a very, very complicated question. But the idea is just to keep them both in your mind as you think about reforming health. We do have a federal debt and we do have things we want to do. So just to keep them both in mind. And, I think the other one we've listed, do we want to go for a system where people are really have good information and they're taking responsibility themselves and they're shopping and this is a market-based system, or do we want to go for a universal system? So again, no right or wrong answers. You're not going to solve it in the forum, but just have people kind of think about those. Now that they've had a lot of ideas on the table, where are they likely to go? Now, at this point in the presentation, we should be hearing from our lovely Kara Dillard, and we're not going to be hearing from her. So I'm going to try to go do her part for her on the next slide. Kara has moderated a gazillion forums. And so she has a lot of information about how you open the forum and how to close the forum. And she's made some suggestions about how to get people to talk about their personal stake. Why did you come out to the forum today? What do you think about our healthcare system? What concerns you most? Sometimes it's good to ask, what was your most frustrating experience? What was your most positive experience with our healthcare system? Get some ideas on the table. How do you see the healthcare system problems affecting our campus, if it's a campus, our community, our state? So there's some good questions to get people started. My sense is that people have a lot of stories. They're very interesting. I think the more difficult aspect of what you will do as moderators is how many of the stories you can take before getting it and how much time you can allow. And you want to get enough stories out on the table so people have some different experiences to listen to. You may have a number of negative experiences. So maybe at some point you can say, does somebody have a positive experience with the healthcare system they'd like to? So get some stories out on the table and then go to the options. And then in the reflections, I think it's a great idea to have some summarizing of, what did we seemed important to all of us. It's very often that people have the same goal, but they have different practical solutions. I think it's very possible on this issue that people really want to get everybody insured, but they have different ideas about how to do it. They really want to keep the healthcare quality very high, but they have different ideas about how to do it. So to talk about some of those, what can we do acting together? What can each of us do acting as individuals? I observed a forum where they were talking about end-of-life issues. And it was very interesting at the end because the group actually, they didn't really want the government or the insurance companies to do anything. But they did, a lot of them talked about, I want to have this conversation in the family. We don't want to put off this conversation until there's really a crisis. I want to get my paperwork together, the living will and it was that the people were talking about things they could do in their families, in their communities and individuals. So it isn't always a change in policy, but sometimes change is what we do to ourselves. So in our last slide, we have some wonderful information for you, which Carol will be telling you about, and I'm going to do it instead. Again, you will have the copy, so you can have all of these links here. All of these resources will be available on the NIFI website. There is an order form if you're organizing a forum, and beginning in late January, there will be an order form to get the free starter forum kit, which is a 2-issue, full issue guides, 25 advices that you could use for your participants. If you have a larger or smaller forum, please talk to Darla, and we'd like to work with you to make these materials available. There is a starter video, there's a moderator toolkit, and there are participant questionnaires. So you can sign up for those, and those will be provided for you ahead of that window for the healthcare forums, which is February 10th to March 13th, I think it is. We do have a video on Hidden Common Ground you can watch. It gives the whole calendar for Hidden Common Ground, There are a number of materials. There's actually quite a wonderful op-ed by David Matthews and Bill Muse, the past president of National Issues Forums Institute. So you can watch that and get some additional information. Kara, whose voice will be back in just, wonderful shape, will be organizing some Common Ground for Action online forums as part of Hidden Common Ground. She's going to do that for all our issues throughout the year. For healthcare, those are February 6, 8, 15, 29, and 13. You can register at the NIFI website to participate in those. If you are interested, Kara can work with you if you'd like to do an online forum, but for your community, and you have enough participants, or as for your institution, perhaps you're at a college or university, you want to do for the student body, and you have the participants. Kara can work with you to organize that online forum for your group and to help you moderate it. So you can do that. And you can see a little sample of Common Ground question for those of you who haven't ever done it. I actually encourage you to sign up and be a participant, because it's a really wonderful and interesting experience to participate in the online forums. And they're different than the in-person forums, but they really are quite engaging. So you have all of us are here: Brad, Jean, Kara, Darla, our colleague Patty has been taking your comments, and she will be leading us on any kind of discussion. Please share questions, ideas. I know a lot of you have done many forums, and you've done healthcare forums, so you may have some wonderful suggestions for the group. So with that, I think we are ready to go to the session for our participants to take part. Do we have any questions?
Thanks, Jean. So I just want to add my welcome to everybody. It's a pleasure to be with you today online. And if you have some questions, or what you've heard has sparked some questions, please feel free to type them into the chat area, which you can find if you put your cursor all the way at the bottom of the screen. You should be able to see the word chat with a little sort of thought bubble above it. And that should bring it up, and you can type your message and send it along, and I'll watch for it. So in the meantime, though, I do have some questions to start with. So let's start with for Brad Rourke.
Yes.
For you. You touched on the difference between an issue advisory and an issue guide. So this question is, aside from the length, are there any other differences between an issue guide and an issue advisory? And another question, how should I decide which one I should use for our forum?
I had myself on mute because I'm right next to a fire department, and there was a fire truck going by, so I apologize. That is a fantastic question. And the short answer is that the material in the issue advisory is the minimum of what you really need to hold a forum. So what you have is the 3 options with the actions and their trade-offs. There's a questionnaire that comes with it. What you're missing is the longer conversation about that sets up the that introduces the issue and that introduces each one of the options. So what a lot of people do, and we're not going to give you any sort of prescription of what you must do, but what a lot of moderators do is use the guide as a way of preparing themselves to moderate the forum, and then people use the advisory who are in the forum themselves, because it's got enough to really get the conversation going. If you wish, everyone can use the guide, then there's no one has any secret knowledge. It's all right there. And all of our prompts for moderators are also in the issue guide. So there's not like a secret sort of, I know what you don't, but there's no fundamental difference between those two things. And it's a great question. You can use either.
Can I add?
Yeah, please.
Yeah, I think it's a judgment call about using the issue guides. We actually developed the issue advisory because a lot of moderators, I mean, people, you know, you give them a guide, but they don't necessarily read it ahead of time. They can't really read it during the forum itself. So the advisory is a kind of a quick take that you can skim, you can use on your lap. But if you're in a situation where people will really read the guide, and or you're pretty sure that if you give them the guide, they will read it afterward, great. You know, because it is a fuller discussion. So, you know, I think that's really a judgment call. But, you know, I think in the meeting itself, I think they tend to rely on the advisory just because people can see it right there in front of them.
Okay, thank you. Okay, I think this is another one for Brad. This is Bill writes, I see vividly that you are not trying to sell your first option to provide universal health care. Was anyone on the committee that produced this guide who advocates for single payer question? And there's another question here, so maybe, shall I give you the other question, or you want to?
Yeah, I see the question, and it's a great one. If I can, everyone can see it. I think who's on the video aspect of the chat. So the question is, so it's kind of twofold. One is, what about with each option, what about the benefits of each option? You've got the actions and you've got the drawbacks. What about the benefits? And also, were there I'll expand the question. So were there people who were involved in the development of this who were in favor of single payer? And were there people who were involved in the development of this who were in favor of keeping ACA? And were there people who were involved in this in having you know, more HSAs and skinny programs? And the answer is that there were people from all walks of life who were fundamentally involved in this. The people who are advocates have looked at drafts of the guide. The development team didn't include people, and this is on purpose and how we do all of our guides. The development team did not have people who have a vested interest or a specific opinion on the issue. We're not pretending that we're totally neutral and distanced, but we are saying that we've tried our very best to give a broad and balanced presentation of the benefits and the drawbacks of each option. So in direct answer to the question about what about like a third column of benefits, that's actually supposed to come out in the essay about each option. You've got a full-throated argument with each option about why we should do this thing. It's not just a bunch of particular little actions with some drawbacks. There's a whole argument for each option, for Medicare for all, or also known as single payer, for keeping things as they are and building on what grows, and for creating more freedom. A strong argument along with drawbacks. It's a great question, and I'm always, if anyone wants to interact with me offline or in an email, I'd be delighted to talk more about the development process and how we try to keep checks and balances so that we're not putting our thumb on the scale for or against any one option.
Okay.
You know, I think another consideration for us is that the guide, you know, particularly in terms of Medicare for all and single payer, does try to explain the benefits of that in terms of being able to bargain and drive down healthcare costs. That's in the guide, it's in the advisory, that's very, you know, very much a part of it, you know, juxtaposed against the other ideas. We did tend to avoid the phrase single payer because so many people had no idea what you're talking about. So, you know, it tries to explain how that would work and why some people support it and other people have concerns about it. But, you know, that phrase itself, does it appear in the, I'm not sure it even appears in the guide, but it was very, very confusing to a lot of people. So we tended not to put a lot of the discussion in those terms.
Okay. And Brad, Bill had one other question about funding. Do your constituent organizations receive funding from any healthcare networks, insurance companies, or drug manufacturers?
I saw that and I forgot to answer. I'm glad you brought that up, Patty. Thank you, and Bill. Kettering Foundation is an independent endowed foundation. It receives no money from any other outside foundation, entity, government. So I hope that answers the question.
Okay, thanks. Jean, I think this one's for you. Patrick writes, I know these forums often build on common values. Any suggestions for navigating a forum when participants may not believe that every individual deserves to have health care?
Well, I think the thing is what it means to deserve to have health care. I think it would be a rare forum where people didn't believe that somebody who was sick shouldn't be taken care of. So the navigation, I think, is it's basically to get people to talk about what is the right to health care. Is it a single payer government plan where everybody is part of it? Or is it sufficient that we have a network of public hospitals and clinics for people to go to? And, I've seen very good discussions on that. I think there's a lot of consideration about what happens to people who have to rely on public hospitals and clinics, and how, if you're thinking about money and you're not insured and it's not covered, you delay going to the doctor. So there's some very practical kinds of things that people can talk about. On the other hand, there will be a lot of concern about having the government have too much power in healthcare, what it's going to cost, how maybe we should improve our clinic system rather than, so, let people talk about that. But I think that people envision the human beings involved. I think it often helps them think through it. From based on what I've seen, people have a lot of experience in their own families with people who have insurance, people who don't have insurance, people who got great care, people who didn't get great care. So they will bring a lot of information to the table if you open that up about what do we mean by right to health care? How does that work? What are we really able to provide for everybody? Will everybody take advantage of it? Those kinds of questions.
Okay, thank you. Amy writes this question. I'm actually going to state the question and then ask Amy if she'll type in a little clarification. So Amy says, how long should I plan for a forum on this? So my question to Amy is, are you talking about the lead up time to a forum? Like how far in advance, how many weeks or days do you need to plan a forum, the convening part? Or do you mean how much time in an evening or on a weekend should be spent on the forum? So we'll let Amy give us a, unless Jean or Brad want to address both of those questions.
Well, I think forums typically are about 2 hours. There's introductions and ground rules and eating the chocolate chip cookies and things like that. So people typically deliberate for about an hour and a half. But I think having a shorter forum is better than having no forum at all. And I've seen, I think the shorter forums tend to raise questions. I'll tell you, my ideal is that when people walk out of the forum, I hope they haven't made up their minds. I hope they have a lot of interesting ideas and questions. I hope they walk out of the forum thinking, I want to know more. I want to read the newspaper. I want to do more and more. So I think that even if your forum is shorter and you can raise a lot of ideas, it's still a very good and thought-provoking experience for people. In terms of the planning, I'm going to, I don't want to defer to Kara because she can't talk. But I know that Darla, you work with a lot of the conveners. I mean, I think it depends on whether you're working with a institution where the people are already there. So if it's a college or university and you're doing with a class, I mean, you really need to get yourself together and get the materials. If you're working in a situation where you're trying to invite people, you may need a couple of months because sometimes you want to work with partner organizations to get people to come. So there's a whole kind of finding the venue, finding partner organizations that will do invitations, getting flyers out. So that's a kind of a different and longer term situation. And I am sure if you want some advice about that, we have some really experienced community forum organizers who would be happy to get in an email exchange with you and share their tips and advice. And some of them are really savvy about how to pull together a community forum.
Okay, thanks. And Amy did clarify that she was talking about the length of the forum. She said if she has 15-minute forum. So thank you, but you answered.
However long you provide, people are going to say that was too short.
That's true. Need more time.
They always say, oh, ahead of time, they'll say, do you really need all that time? And then at the end, they'll say, why did you make this so short? This should have been longer.
Goes fast.
You know, I have been in the situation many times of describing the NIF forum process to people in Washington, D.C. or to experts. And one of the first things I say is that, you know, typical citizens got together and they talked about, you know, how to think about the healthcare system for 2 hours. And they said, you know, I think they are really impressed that citizens gave that amount of time to thinking about an issue and looked at alternative points of view. So it doesn't happen all the time. You know, we live in a society of a lot of knee-jerk reactions and top-of-the-head reactions, and we're all busy. We don't have a chance to get together and think with others. So I think it's an impressive accomplishment when people get together, whether they talk for 45 minutes or an hour and a half, or 2 hours.
Okay, thank you. This is a question from Robert, either probably for Jean or for Darla. We may have small groups of 6 to 8 in numerous places. Will each group moderator receive hard copies of the guides, hard copies of the advisory materials, etc., for free? Question.
I will, Darla, you can, I'm sure we can work with that.
Absolutely. The order form is available now. You can start ordering your issue advisories, issue guide, and there's a space on the form that you can let us know what you need for a successful form, and we're more than happy to work with you.
Okay.
And there is no charge.
Exactly.
There was a question on the scroll about, like, I don't see the guide yet on the website. When's it going to be up? And I did answer, but I realized there's a lot of people just on the phone. So it's on press right now. So it's you know, it's happening. We should have it on the website, I hope by the end of the month. And our goal is to have it in your hands if you need it by February 3rd. So you've got a full 7 days before that window we've been talking about. And if there, for some reason, you need to take a peek, you know, early, you know, get with me or Jean, or, you know, and we'll work with you. But so it's imminent.
The advisory, by the way, is already up.
It is on. The advisory is on.
In terms of just the basic layout of the advantage of each option, the risk of each option, and what kind of actions, you know, it's in a crisp form without the kind of lovely sort of explanation. But you know, that certainly will help you begin to wrap your head around what might come up in a forum.
Yeah, yeah.
Thank you. And a question from Gail about how the welfare system is handling this issue.
Well, one of the, I don't know, I'm not sure this is the answer to your question. You can tell me if this is not the answer to the question. You know, in the build on the system, I mean, you know, first of all, the Medicare for All has a whole different approach to how people get health care. In the build on what we have, Brad, is this right? One of the actions is to have every state expand Medicaid. So that because not all states have taken advantage of that really increased the number of people who had health coverage. So that, I think it's the top action, so people can talk about that in terms of that. So, you know, there's certainly a lot of consideration in the book about people and the healthcare system and people who may not be able to afford. You know, may not get it their job, may not be able to afford it, don't have the savings, you know, have postponed healthcare. There's a lot of concern about lower income people and our healthcare system and how well it works for them.
Okay, I think this is probably to Jean Johnson, also from Barbara. This issue being part of a hidden common ground Are there plans to report on this and other forums before the end of the year?
The way we are doing this is that we actually have an observer and a reporter working on the House Divided forums, which were conducted in the fall. And we are hoping to have that report out to you in some reasonable short period of time. And then we will be observing and reporting on the healthcare forums. And by our national conference, which is in May, there will be a report on both the House Divided forums and the healthcare forums available in May. Then we will do the same procedure for the immigration forums and the economy forums, which happen this spring, summer, and fall. And there will be a report early in 2021, which I can't even believe we're talking about 2021 now, but that covers all the issues. So there will be, kind of bite by bite reports available as we can get them done, and then 2 of the issues in May and all of the issues early next year.
Okay, thanks, Jean. Brad, I think I'm going to send this question to you because maybe it would touch on some of the process of the framing of the issues and the options. Juliet writes, I've also talked to many people who believe that if someone doesn't have the funds for insurance or care, that is a choice that they made.
Yeah. One way to look at the role of the issue framework, the issue guide, the materials you're using is, a lot of times we try to have as diverse a group of people in a forum as possible, so we have lots of different viewpoints. Sometimes we don't get every viewpoint, and so we try to make sure that people who have a whole range of viewpoints, including ones that we find very uncomfortable, can find voice in the various options. Somewhere in that guide, they see themselves in. And I saw Juliet's comment, and I loved that we're kind of having the forum in the text. Which always, to me, that means, oh, we got a good issue here. This is good. People want to talk about this. We heard that in the framing process as we talked to people in places and got their concerns, and they talked about healthcare. We heard that not just once or twice, and so the issue of, we have a responsibility to take care of ourselves. There are people who say that, and that the responsibility to do so for oneself indeed trumps the responsibility that we have as a society to care for all. So there's got to be room for the folk that we really strongly disagree with in these conversations. And it as a moderator, I mean, this is for people who want to convene forums, this meeting here. So it can be very anxiety provoking to think, oh, I have to address all of these viewpoints, some of which I agree with, some of which I don't. The issue guide is there, and I think you can pretty fairly rest assured, almost for any NIF issue, that any of the main viewpoints that you might somewhere in that guide, that they're in there, and that there's someone who's quietly holding that view in the forum, and maybe they're afraid to speak up and they don't want to, they'll be able to find in that guide something that they agree with and that they disagree with.
I think the other thing I would add, I know all of you have done forums, know this is true. The participants in the forum are such a font of information and consideration, so that if you have somebody in the forum who just doesn't think somebody who doesn't have insurance is because they're spending their money unwisely or that's their choice. I mean, you're going to have somebody else in the forum who has been uninsured for a time and has gone through it and knows what it feels like. So part of that is in a very respectful way to get people to bring out their own experiences and why they feel the way they do. And some of the most powerful moments in forums occur when those kinds of encounters, when somebody who's sort of talked about other people in a certain way sees somebody in the room who is sympathetic and right in front of them, and then they've had a different experience. And so I think that is actually the magic of the forums.
Yeah, it's remarkable.
Thank you both. So we did strike up a nice little conversation in the chat about the length of forums. People were interested in the convening, the nuts and bolts. Kara says,
3 hours now.
yeah, Kara says, I usually stick to about 2 hours in length, including pizza. How awesome is that? And coffee time at the beginning. And Robert says one could have 2 sessions so that folks could think about what transpired in the first session. And as Staley said regarding Brad's time comment, yes, in capital letters, every time I'm like, quote, maybe we will finish a little bit early today. And then we run long and people are still talking. Keeping equal time for each option is the hardest, but worth it. Then people bring everything up again in the reflections.
Is that Lissa?
And, what's that?
Is that Lissa Staley?
Yes.
Yeah.
Yeah. And then maybe this is something that I think maybe this will be the last, it's sort of a statement, but I'm going to turn it into a question for Brad and or Jean. From Robert. Robert writes, it will be important to strive for what Haidt calls, quote, viewpoint diversity, and that involves recruiting participants from different political persuasions, etc. So maybe if you'd like to comment on that, and then we'll wrap things up here.
Yes.
I think that this is one of the most powerful things NIH do, because there are so few places where we can talk to people and hear from people who have a different take on the issues and learn to understand them and exchange views with them. And so I think that is extremely important. I think we think about trying to bring together people of different ages, different backgrounds, different experiences, different political perspectives. I have noticed, and this is something to think about with these forums, if you're doing a forum on the economy, that it's so helpful to have 1 or 2 small business people in the forum. So just getting people with some different experiences so they can share them and kind of work together and think together about the best thing. I'm always surprised at the reaction of people who you can tell, have very different views politically about what should be happening in the world, and yet, feel that there's something happened in the forum where they listened and are thinking about things they hadn't thought about before. And we do these surveys after the forums, and about 4 in 10 people say they heard something in the forum they haven't heard before, and all of these issues are just covered day in and day out in the media. So we're doing something right.
Okay, thank you, Jean. And I'll just finish with Joe Aline, and I'm very, very sorry if I'm mispronouncing anyone's name. Makes a comment regarding Juliet's comment, and similar as a moderator, we explore the assumptions behind what kind of comment, fears, and needs, and reality testing, various illnesses that people who have things that can't get treated. And Bill cited some resources and information. And I just wanted to let everybody know you can actually save the chat if you'd like to. If you go to the bottom to the right of where it says file, and there's a few dots there, and you click on that, it gives you an option to save the chat if you'd like to do that. So we have pretty much reached the end of our allotted time. We are going to try to not stay longer than we planned. So I especially want to thank Darla Minnick for organizing the Zoom call webinar. Yeah. Thank you, Darla, very much. And to our presenters, Jean Johnson and Brad Rourke and Kara. She was very helpful in the chat, and she does the heavy lifting for the online forums, which we appreciate very much. And we'd especially like to thank all of you who joined us today for this webinar conference call. We hope that you're excited about this project as we are, and we hope that you'll seriously think about jumping in and planning some forums. We hope you'll stay in touch and let us know what kind of exciting things you're doing, because we love hearing from you. So good luck with all your plans. Best wishes to all, and have a great rest of the day. Goodbye, everybody.
Thanks so much, everybody.
Thank you.